Hello everybody, welcome back to another live stream for Anatomy and Physiology. Today we're focused on Anatomy and Physiology 2 today for the HESI and TEAS. Welcome to everybody. We'll get started here in just a moment. How's everyone doing today? Good afternoon or good morning. You are just waking up. Welcome everybody, welcome. We're going to do some Anatomy and Physiology 2 for the HESI and TEAS today. How's everyone doing? Hope you guys are all doing well today. Hello, welcome in everybody. Welcome in. We'll get started here in just a moment. Hello, if you're new here, my name is Ollie. I have a master's degree in molecular medicine. I do go live almost every day. The next 2 weeks here while we're on break, not so much, but starting May 26th, we'll be going back again live every single day. I might be interested in doing some pop quizzes on certain things if you guys are interested, if there's any certain requests on something. And then I do post pretty much every day on TikTok as well. Mostly Anatomy and Physiology and anything else that you guys kind of request. Hello, how's everyone doing? Thanks for liking the live, thanks for sharing the live. You guys are awesome. We'll get started here in just a moment. But welcome in, hello. Hello everybody. Thanks for joining. I appreciate you guys being here. I appreciate you guys giving the live a like. It does get it out to more people if you guys do like the live. We'll get started here in just a moment. Again, we're going to be going over some Anatomy and Physiology 2 for the HESI and TEAS. Just some good review. And I do post these to YouTube afterwards as well. The link that is in my bio. And then I also have study guides for Anatomy and Physiology on my website as well. But we'll start now. Everybody, welcome. We're on number 1 now. Which chamber of the heart pumps oxygenated blood into the systemic circulation? And hello, if you're new here, welcome. My name is Ollie. I have a master's degree in molecular medicine. I have been tutoring Anatomy and Physiology for 5 years now. And I try to go live. My name is Ollie. I have a master's degree in molecular medicine. I have been tutoring Anatomy and Physiology for 5 years now. And I try to go live almost every. Oops, sorry about that, guys. We're on number 1 now. Give me 1 sec. Gotta fix my stupid phone. Here we go. Awesome. Sweet, awesome. The answer is the left ventricle. So our left ventricle is going to pump oxygenated blood through the aortic valve to the aorta and then out to the rest of systemic circulation. And then number 2, what is the primary pacemaker of the heart? What is the primary pacemaker of the heart? And hello everybody, welcome in. I've been tutoring Anatomy and Physiology for about 5 years now. We are doing some Anatomy and Physiology review for the HESI or TEAS. Welcome in. We are on number 2. What is the primary pacemaker of the heart? The answer is C. It is the SA node. So the SA node is, or the sinoatrial node, is the natural pacemaker of the heart. It is located in the right atria. This is going to initiate the electrical impulse that regulates the heart contractions. The AV node follows, and it is sort of a secondary pacemaker. It delays the impulse from the SA node. It doesn't initiate the primary heartbeat though. And then we move down to the bundle of His. This is going to transmit the impulse from the AV node to the ventricles, but it does not, again, serve as the primary pacemaker. And then we have our Purkinje fibers. This is going to spread the electrical impulse to the ventricular muscle cells. Alrighty, fantastic. Number 3, stroke volume is defined as what? Stroke volume is defined as what? Thank you guys for all the likes on the live. I appreciate you guys. These are always fun to do. I'll at least kind of request a study day for the EXCPT. I take my state exam this Friday. Send me my emails in my bio. Send me an email. We can talk about it. Or send me a DM afterwards. Is that for pharmacy technician? Thank you. Hello, everybody. Welcome in. Yes, it is. Okay. Yeah, we can definitely talk about that. I was a pharmacy tech for 4.5 years, so my favorite class. Perfect, Violet. Yeah, thanks for joining. Good to see you again. We're on number 3 right now. Stroke volume is defined as... It is the amount of blood ejected from the ventricle per beat. So stroke volume, again, the amount of blood the heart ejects per contraction of the left ventricle. B is actually, the heart rate is multiplied by the cardiac output. So cardiac output would be heart rate times stroke volume, not the other way around. C, the amount of blood pumped per minute. That would define cardiac output. And then D, the blood pressure in the aorta. Blood pressure is a force, it is not a volume. Number 4, which factor directly increases cardiac output? So increases cardiac output. So why is it not B? So B, the heart rate multiplied by cardiac output. So cardiac output is equal to heart rate times the stroke volume. So this is saying that stroke volume equals heart rate times cardiac output. That's wrong. It's cardiac output equals heart rate times stroke volume. What's the name of the textbook you use in A&P 1? There were a couple. So I used in A&P 1, I had my lab textbook. I actually have all of my recommendations on my website if you want the exact names and the professor or the authors and whatnot. But number 4, the answer is B. It is increased heart rate. So again, if we look at the formula, cardiac output is equal to heart rate times stroke volume. So by having a higher heart rate, we would increase our cardiac output. Same thing with stroke volume. If we had a higher stroke volume, we would increase cardiac output. So reduced stroke volume would decrease it. Decreased venous return and vasoconstriction. Decreased venous return would be less blood returning to the heart. That would reduce stroke volume, thus reducing cardiac output. Vasoconstriction increases blood pressure, so it would not necessarily have a direct increase in cardiac output. Number 5, the Frank-Starling law states that an increased preload leads to what? An increased preload. I believe these questions may be on my website. I have practice questions on my website, or they'll be on YouTube afterwards. Every single video that I do on TikTok gets uploaded to YouTube. But we're on number 5 now. The Frank-Starling law states that an increased preload leads to what? The answer is B. It is increased stroke volume. So the Frank-Starling law states that more heart muscle is stretched, so an increased preload. This would lead to a stronger contraction, so contraction strength, leading to a higher stroke volume. All right. Hopefully that makes sense. But number 6, moving on. Which blood vessels are responsible for gas and nutrient exchange? Which blood vessels are responsible for gas and nutrient exchange? Fantastic. It is C. It is capillaries. So capillaries have the thin walls that allow for the exchange of oxygen. Number 7, blood pressure is primarily regulated by. What is blood pressure mainly regulated by? Hello everybody, welcome. If you're new here, welcome. If you are been here before, welcome back. If not, my name is Ollie. I do go live just about every day. We are going to start going live again every day, May 26th, in line for the summer semester. For now, we'll see about the rest of the week for going live. I know there was some request for pharmacy technician exam. So definitely send me an email if there's anything that you wanted to see. Politics, that's funny. Thank you for the heart, I appreciate it. Thank you for the gift, I appreciate you so much. Awesome. The answer is B, the autonomic nervous system. So the autonomic nervous system, or the ANS, will regulate blood pressure through sympathetic activity. So sympathetically, it would increase our blood pressure, and parasympathetically, it would decrease our blood pressure. The cerebrum controls voluntary functions, skeletal muscles. It is true that they do help circulation in venous return through their contractions. But they don't directly regulate blood pressure, and the small intestine has no direct role in blood pressure regulation. Number 8, which hormone increases blood pressure by promoting vasoconstriction? Hello everybody, thank you for all the follows. I appreciate it. If you're new here, welcome. Copies of this, I do have exams on my epinephrine is adrenaline, right? Yes, correct. Secreted by the adrenal medulla. Cortisol is by the adrenal cortex. I do have practice exams on my website. This one in particular, I'm not sure if that one's up, but I do post these to YouTube afterwards as well, for you to go through at your own pace for free. But I do go live almost pretty much every day. Right now, just because it is break time, not so much. But May 26th, we'll be back again live every single day. This week will be by request for live streams. The answer to number 8 is C. It is epinephrine. So epinephrine, otherwise known as adrenaline, causes vasoconstriction. This is going to increase blood pressure. Number 9, a patient with uncontrolled hypertension is at risk for. A patient with uncontrolled hypertension is at risk for. Perfect. It is B. It is heart failure. The reason being that uncontrolled high blood pressure would force the heart to work harder than it should. Over time, that will lead to heart failure. Hypovolemia is hypertension that is associated with high blood volume. Decreased cardiac output. Initially, hypertension would increase cardiac output. And then dehydration is not directly caused by high blood pressure. Again, it is indirectly, but not directly. Number 10, which ion is essential for cardiac muscle contraction? Which ion is essential for cardiac muscle contraction? Does aldosterone help to increase blood pressure as well? Yes. Aldosterone is part of the adrenal cortex in the renin-angiotensin-aldosterone system, like the RAAS system. What it does is increases sodium reabsorption in the kidneys, thus increasing water retention because water follows sodium, and excreting potassium. So by reabsorbing more sodium in water, blood volume increases, higher blood volume, higher blood pressure. And the answer is B, calcium. So sodium is important for action potentials, but not the contraction itself. Calcium is required for muscle contraction. Calcium is going to bind to troponin, which is going to remove tropomyosin off of actin active sites. Myosin heads are going to latch onto the actin, pull it towards the center of the sarcomere, giving us our contraction, which makes calcium essential for cardiac muscle contraction. Number 11, the primary function of the alveoli is... Fantastic. It is gas exchange. So the alveoli are the tiny air sacs in the lungs. This is where oxygen and carbon dioxide are exchanged between the lungs and the bloodstream. Number 12. What is the primary driver of ventilation? What is the primary driver? Also, thanks again for all the likes on the live and also for all the shares and follows. You guys are awesome. I appreciate you guys. Thank you guys so much. These are always fun to do. The answer is B. It is carbon dioxide levels. So carbon dioxide, the body regulates our breathing primarily in response to our carbon dioxide levels. So if we have high CO2 levels, this is going to lower our blood pH, which is going to increase our ventilation. And then the opposite occurs. If we have too little CO2, it is going to increase our blood pH, decreasing ventilation. So high levels of CO2 decrease blood pH, causing an increased ventilation. Decreased carbon dioxide increases blood pH, decreasing ventilation. Oxygen levels play a very minor role in ventilation regulation. Mostly this is if oxygen levels were to drop or rise extremely significantly. pH levels, yes, they are important for answer choice C, but the pH level is directly affected by the carbon dioxide levels. So pH gets regulated by the carbon dioxide levels. And the nitrogen levels, nitrogen is pretty inert in the body. It doesn't really drive ventilation. Number 13, which muscle is responsible for inspiration? Mainly, so primarily. So we'll put primarily or mainly. Let's do mainly. Mainly responsible. Thank you for the email response of the TEAS tomorrow morning. I appreciate you for these reviews. Absolutely. Good luck on your TEAS tomorrow morning. You got this. Rosalind, you're going to do fantastic. I believe in you. But anyway, the answer is B. It is the diaphragm. The diaphragm contracts to increase our lung volume. This allows air to flow in. Number 14. The majority of oxygen is transported in the blood by what? Pass my HESI with an 88. Thank you, Ollie. Congratulations. That is awesome. Can we get a congratulations in the chat? That is incredible. I hope you're proud of you or of yourself. I'm definitely proud of you. Thanks for all the follows, everyone, as well. Thank you. If you're new here, welcome. My name is Ollie. I have a master's degree in molecular medicine, and I do go live pretty much almost every single day covering anatomy and physiology and some other topics that you guys do request. Right now, we're taking a little bit of a break from live streams, but this week I will go live if it is requested enough. But starting May 26th, we will definitely be going live every day again. Just in line for the summer semester. I do upload all of these live streams to YouTube afterwards as well. The link to that is in my bio. And then I also have all of my study guides from when I was in anatomy and physiology, also linked in my bio on my website. The same answer for... Yeah, I know. I make the question, and then I kind of randomly put them, and sometimes they just end up in the same place. But I once had a professor that had all answer B for the whole 50 question test, and everyone was freaking out. And then the next one, B was all the answers, and then there was one question that was C on the exam that was right, and everyone lost their mind. Taught us a lesson. Yes, this will be on YouTube later. Yep. But number 14, the majority of oxygen is transported in the blood by B, hemoglobin. Hemoglobin, oxygen binds to hemoglobin in red blood cells to allow for transport. Number 15, a right shift in the oxygen-hemoglobin dissociation curve would indicate what? Thank you. I definitely need someone to take for massage therapy in June. Do I help with chemistry? I do some chemistry, yes. You said a professor. This is why I have PTSD. Yesterday's live is currently being uploaded now. It's just processing. My about to find out was 100 questions. I got 90. Awesome. Congratulations, Nicholas. That's awesome. Fantastic. But the oxygen hemoglobin dissociation curve, right shift would indicate C, increase oxygen unloading to tissues. So a right shift means that hemoglobin has a lower affinity for oxygen. This allows for oxygen to be released into tissues more. Number 16. Which condition is characterized by the destruction of alveoli leading to reduced surface area for gas exchange? We have 60 questions today. The HESI TEAS is an entrance exam for nursing schools. The requirements depend on the school. So if right shift is lower, how does it increase instead of decrease? So we have our hemoglobin. Affinity means kind of like its ability to bind to something. So if we have oxygen, and if we have a lower affinity for oxygen to hemoglobin, and we have tissue, if we lower the affinity of hemoglobin, that means that more oxygen is going to go to tissue rather than hemoglobin, since less is binding to hemoglobin. And then which condition is characterized by the destruction of the alveoli leading to reduced surface area for gas exchange? The answer is C, it is emphysema. Emphysema, the alveolar walls break down, reducing the surface area for gas exchange. When you reduce the surface area, you reduce its function. Inversely, if you increase surface area, you would enhance its function or promote its function, especially when it comes to absorbing or diffusion. But number 17, hyperventilation would lead to what? Thank you for all the follows, everybody. Thanks for sharing the live as well. Thank you for the finger heart, Bailey. Appreciate you. If I miss any questions, feel free to put them back in. Sometimes I just miss them when I'm writing on my screen. All right, but it is B. Hyperventilation leads to respiratory alkalosis. Hyperventilation would cause excessive CO2 loss. So we would have a decrease in our CO2 levels, which would increase our pH, leading to alkalosis, because higher pH is more basic, alkaline is basic. Inversely, respiratory acidosis, this would occur when CO2 would accumulate, lowering the pH, causing it to be more acidic. Metabolic acidosis is that's related to metabolic issues, not breathing. Increased carbon dioxide levels is false because, again, hyperventilation decreases carbon dioxide levels. Number 18, what structure prevents food from entering the trachea? Groover, I passed my TEAS with a B. Your lives were such a help with anatomy and physiology. Thank you so much. Congratulations for passing your TEAS. It's awesome. Can we get a congratulations in the chat for our viewer? That'd be fantastic. Looking to get the study guide for A&P1. How many chapters are covered? In the A&P1 bundle, it's chapters 1 through 16. So it's all of anatomy and physiology content. It covers all the way from the start up until the end of the nervous system, through like the general senses and reflexes. And then my A&P2 is endocrine system through the reproductive system. Mine did up to chapter 28, so that's 17 through 28. And then a couple of them are combined, just because a lot of the information was pretty similar or referenced a lot in other chapters. I'll take A&P in 2 weeks. Awesome. Thanks for following. I appreciate it. I definitely will be doing these a lot more in 2 weeks and whatnot. We'll definitely be ramping up the content for the summer semester. Absolutely. Summer classes are always brutal when it comes to the sciences. So absolutely, we're going to ramp up the content. But again, 18, what structure prevents food from entering the trachea? It's the epiglottis. That is the tissue that covers the trachea during swallowing, preventing food from entering the trachea. The uvula, that would help with speech and swallowing. It doesn't block the trachea, though. The soft palate, that helps close off the nasal passage during swallowing, not the trachea. And the esophagus is what's going to carry our food. Number 19, the respiratory control center is located in the... Respiratory control center is located in the we have lab 2, so is labeling included in that bundle? Yes, it is, yes. Especially, I think, so chapters 7 and 8 are for skeletal system, appendicular, and axial. And then the muscular system is labeling. And then there's some nervous system labeling. But yeah, pretty much labeling, tissues labeling, skin labeling. Yeah, pretty much everything. Thank you for the roses, just BB and Gans for the finger hearts. I appreciate you guys. Thank you guys so much. Thanks for all the follows as well, everybody. Thank you. Okay, I'm taking this summer. Wish me luck. Yeah, Larissa, good luck. You got this. Definitely send me an email or a DM if you have any questions as well on the on the study guides and notes. More than happy to answer them too. Good luck. I'm about to take this class this summer. Awesome. Yep, we'll be ramping up the content this summer for summer classes and summer semester. The answer is B. It is the medulla oblongata. So the respiratory control center is located in the medulla oblongata. The medulla oblongata is a structure in the brain that is going to regulate our breathing rate and our rhythm, so our autonomic functions. The hypothalamus is going to regulate body temperature and emotions and hormones a bit. Cerebellum is going to control our coordination, and the cerebrum is mostly involved in like our higher thinking. Number 20, which lung volume is the max amount of air that can be exhaled after a max inhalation? My email is in my TikTok bio. But it's medzig.ollie@gmail.com. But it's in my TikTok bio. And it's on my website as well. And if you don't want to send an email, I also have like a form submission on my website too on the homepage. I haven't started, but I'm starting in July. Scared I'm not good at memorizing. Memorization, honestly, we can do some at the end of this. I'll lose my mind crazy that I'm doing a lot of yeah. Taking my NREMT this Friday. Good luck on your exam. Just finished Anatomy 2 and never been happier to be done. Congratulations on finishing Anatomy and Physiology 2. Thank you, Just BB, for the more roses. Appreciate you. But number 20, the answer is C. It is the vital capacity. So vital capacity is the max, the total or maximum amount of air exhaled after a maximal inhalation. Residual volume is the air that would be remaining in the lungs after a maximal inhalation. Tidal volume is the normal amount of air that's in and out during regular quiet breathing. Expiratory reserve volume, this is additional air that can be exhaled after a normal exhalation. It would not include the inspiratory capacity, though. Moving on to number 21. The primary site of nutrient exchange is the what? The primary site of nutrient exchange is the what? I learned it by Chinese. I don't know the English name. Oh, gosh. My AP2 finals this weekend. Then on to the TEAS. Awesome, my queen. Coco, good luck. You got this. Just keep strong. Stay focused. You got this. The answer is C. It is the small intestine. The small intestine, specifically, mostly the jejunum and the ileum, this is where most nutrient absorption occurs, including carbs, proteins, lipids, vitamins, minerals, etc. The stomach is primarily for protein digestion. I bumped my thing. Large intestine, absorbing water and electrolytes. Esophagus, it's a passageway. Number 22, which enzyme breaks down starch into maltose? So again, we're referring to what's going to break down carbs on number 22. Hello, new here. Thank you for doing this. It helps. Awesome. Thank you so much. Yeah, of course. Thank you for being here. I'm glad that these are helping. I love doing these live streams. I appreciate all the follows. Thank you for being new here. If you're new here, welcome. My name is Ollie. I do go live essentially almost every day. With it being, I know summer semester starts up in like 2 weeks or so on like May 26th. This is when I will be returning to go live every day. This week we'll be off and on live just because not many people are in classes and I'm tutoring right now. But May 26th we'll be going live every single day. I can cover some of this in my Anatomy and Physiology 1 class. Yep, this is more so for Anatomy and Physiology 2 today. This is for Anatomy and Physiology 2 today. Mine starts Monday. Yep, we'll be doing a live stream next week on Monday and Tuesday. So Monday and Tuesday. So Monday will be ANP1, Tuesday ANP2. And then this week and next week will be requests for live streams. So if there's popular requests for something, we'll do one. But if not, we'll be back again live every single day starting May 26th. And then I do upload these to YouTube afterwards as well. That's linked in my bio. And then again, all my study guides are also linked on my website there. But number 22, the answer is B, amylase. We have salivary, which is in your mouth, and then we have pancreatic amylase, which comes from your pancreas. This is going to break down starch into maltose, which is a disaccharide. Pepsin breaks down proteins. Think of peptide. Lipase, lipid, breaks down fats. Trypsin, it is the active version of trypsinogen that's secreted by the pancreas. This is going to be involved in protein digestion as well. Number 23, bile is produced in the nuts. So think about, it's produced and then it's stored and released. So what is it produced by? And then if I miss any questions, feel free to put your questions back in there. Sometimes I write and I don't look, so I miss some. This is a great refresher. I finished AMP2 last summer, but I'll take my TEAS in June. Awesome. Good luck on your TEAS in June. You got this. Take my TEAS test Thursday. Good luck, Sabrina. You got this. I have my AMP final tomorrow, so you're doing Lord's work right now. Thank you, Claire. Good luck on your final tomorrow. Yes, I do have practice sheets or study guides. They're all on my website. They're linked in my... Oh, never mind. Okay, gotcha. My comments are being really weird. Hold on one sec. There we go. Perfect. Yep, my live sessions are normally at 1 p.m. and we go for about an hour to 2 hours normally. Kind of just however long it takes to get through the questions. Sometimes it takes longer, sometimes it doesn't. But bile is produced in the liver and then it is stored and released by the gallbladder. So just because something releases, it doesn't mean it necessarily produces it. And then we use bile for fat emulsification. Basically, it turns fat into smaller droplets. And then lipase will break those droplets down even further that we talked about up here. Number 24, which hormone stimulates the release of digestive enzymes from the pancreas? Thank you, Gans, for the 10 finger hearts. I appreciate you. Take my exit HESI next month. Awesome. Good luck, Xavier. 1:39 a.m. here. Oh my goodness, so you're 12 hours ahead or behind? I think you're ahead, probably. That's crazy. Well, welcome in from 1:39 a.m. What happens if you don't have a gallbladder? If you don't have a gallbladder, you can still digest food, but in terms of your fat digestion, that will change immensely. So again, the gallbladder, think of the normal function. It stores and it concentrates bile that gets made by the liver. It is going to release bile into the small intestine when you eat fatty foods. Bile helps break down the fats for digestion, but if you don't have a gallbladder, bile is no longer stored, so it kind of just drifts into the liver. From the liver into the intestine. So it's less concentrated and it's just less efficient. So it's definitely recommended eating lower fat meals if you don't have one. Perfect. The answer is B. It is CCK. So CCK is released in response to fats and proteins in the small intestine. It is going to stimulate pancreatic enzyme secretion. 25, the function of the large intestine is to... So we talked about most of the absorption of nutrients is going to occur in the small intestine. What follows? So whatever is left from the small intestine, what happens to that material in the large intestine? Awesome. It is B. It is to absorb water and electrolytes. This is what's going to form our solid waste. Moving on to 26. What structure prevents acid reflux? If we have our, draw our stomach here. So if this is our stomach, what structure is going to prevent acid reflux? Perfect. It's going to be B. It's going to be our LES, or our lower esophageal sphincter, which is located right here between the esophagus and the stomach. And then we have our pyloric sphincter. It's going to separate food passage from the stomach into the small intestine. The ileocecal valve is what separates the small from the large intestine, and the anal sphincter is what controls the release of feces at your butt or anus. 27. The main function of the stomach is fantastic. It is A. It is protein digestion. So the stomach primarily breaks down protein using pepsin and hydrochloric acid. So hydrochloric acid is going to activate pepsinogen into pepsin. 28. Which cells in the stomach secrete hydrochloric acid? Which cells in the stomach secrete hydrochloric acid? And then also, again, I do upload these to YouTube afterwards, so if you want to go back, and if you join late or you can't stay the whole time, you can go back and watch and answer all the questions at your own pace on YouTube. It's linked in my bio. It's also just my name. It's Ollie Hertzeg. And then the answer is B, is the parietal cells. I just took an exam on these yesterday. These questions are on the TEAS. So these questions are just review for the TEAS. Just review. We're reviewing. Specifically right now, we're talking about parietal cells. So parietal cells are going to secrete hydrochloric acid. So parietal cells produce hydrochloric acid, like I talked about, that helps digest food and activates pepsinogen into pepsin to digest proteins. Number 29, which substance emulsifies fats for digestion? Fantastic. We talked about that with the liver and gallbladder. Bile is going to emulsify fats into smaller droplets for lipase. So that would answer our next question. The primary function of pancreatic lipase is to digest fats. Again, fats has lipid in it. Lipase has lip. So lipid. Moving on. Number 31, the primary function of the lymphatic system is to Thank you for all the follows and all the likes on the live, everybody. I appreciate you guys. You guys are awesome. Thank you for the participation as well. I hope this is helping you guys review. The answer is B. We are going to return excess interstitial fluid to circulation. So the lymphatic system is going to collect that excess interstitial fluid, which is fluid that will leak from capillaries into tissues, and we will return it into the bloodstream, preventing swelling. 32. Lymph is filtered by which structure before returning to circulation? Thank you for these videos, of course, absolutely. Thank you for being here. I truly appreciate you guys being here. The answer is A, it is lymph nodes. Lymph nodes filter lymph. What it filters out are pathogens and cellular debris, basically before the fluid is returned to its circulation. Number 33, which white blood cell is primarily involved in adaptive immunity and the production of antibodies? Again, so when we're talking about white blood cell, adaptive immunity and the production of antibodies, what type? Take my MP2 final in 20 minutes. I'm cooked. No, AJ, you're not cooked. You got this. Vanessa says this helps a lot. Thank you. Thank you, Vanessa. Anna, thank you for these videos. I'm a vet student, but these are still so helpful. Awesome. Thank you so much. I'm glad they're helping. Thanks for being here. I have an anatomy final tomorrow. 100 questions. Oh my goodness, Carolina. Good luck. You got this. Take your time. Study hard. Focus. Get a good night of sleep tonight. You got this. Then summer. Hopefully you have a nice summer break. The answer to 32 was lymph node. Appreciate the support. No problem. Cook the exam. Don't let the exam cook you. The answer is C, lymphocytes. So lymphocytes, B cells, and T cells are the primary cells involved in adaptive immunity, basically including antibody production and cell-mediated immunity. B cells are for antibodies. B cells for antibodies. Adaptive immunity is both B cells and T cells. T cells are more for cell-mediated immunity. Number 34, the thymus is responsible for... Thank you for these videos. Help so much. Awesome. Yeah, no problem. Thanks for being here. I love doing these live streams, so I really, it means the world to me that you guys are spending your time here with me. That's the goal, just to help make anatomy and physiology a little easier in review. Jog the memory sometimes. But hello, everybody. Welcome in. Welcome in. Thank you, Just BB, for the more roses. I appreciate you. Thank you. I appreciate you, too. But number 34, the answer is B. It is maturing T cells. So the thymus are where T cells, which again, the lymphocyte we talked about, that is responsible for a cell-mediated immunity. This is where they're going to mature before they enter the circulation to fight off infections and perform their cell-mediated immunity. Moving on to number 35, which lymphatic organ is responsible for filtering the blood and recycling old red blood cells? And hello to everybody that did just join. Welcome in. My name is Ollie. I have a master's degree in molecular medicine. I've been a tutor for 5 years. I was a pharmacy tech for 4.5 years. I'm working on getting my PhD. And I do go live pretty much every day. Starting May 26th, we'll be live again every single day. Just because it is a summer break right now, we haven't been. But May 26th, we'll be going live every day. The replays will be uploaded to YouTube this week, next week, Monday and Tuesday, 1 p.m. Eastern Standard Time. So next week, Monday and Tuesday. I may go live again this week and next week outside of Monday and Tuesday. It is by request. Send me an email. It's linked in my bio. And then also my website is linked there, as well as my YouTube. And my website just has all my study guides for anatomy and physiology. But we're on number 35 now. Which lymphatic organ is responsible for filtering blood and recycling old red blood cells? The answer is the spleen. Specifically, the spleen is going to recycle the iron and the heme. Yep, we do TEAS review. This anatomy and physiology is mostly for TEAS and HESI. Like using these to keep my memory fresh. Awesome, M. Thank you for being here. Number 36. Lymphatic capillaries differ from blood capillaries because they... Thanks for all the follows, everybody. Thanks for all the shares as well. You guys are awesome. I appreciate you guys. Where do I get these questions? I do make these myself. So I go through my textbooks and all my materials, and I make these questions, and then I have friends who have taken the HESI and TEAS, and basically they will let me know if the questions are good for review. Number 36, lymphatic capillaries differ from blood capillaries because the answer is B, they are more permeable. So lymphatic capillaries have larger openings. Essentially, this is going to allow fluid and proteins and even like cells. Like we're talking about we want to filter cellular debris that has to fit through there so that it can get filtered. Transporting red blood cells. They do not carry red blood cells. Lacking valves, that is untrue. Lymphatic capillaries do have valves. They prevent backflow of lymph. And carrying oxygen, again, does not transport oxygen. That is the function of blood. Basically, they are more permeable, so larger materials can flow in there and then get filtered. 37, the fluid in the lymphatic system originates from number 37. 37, we kind of talked about earlier. Again, we're returning interstitial fluid from the tissues. So lymph comes from interstitial fluid, which is the fluid that surrounds cells and leaks from the capillaries. Number 38, which of the following is not a function of the lymphatic system? Which of the following is not a function? Give you guys just a moment. Some people get this one wrong. It's okay. We'll talk about it. So the answer is D. The lymphatic system does not regulate body temperature. Body temperature is managed by circulatory, nervous systems, stuff like that. So, absorbing dietary fats. This is true. The lymphatic system absorbs fats in the small intestine via lacteals. Transporting hormones. Some hormones do travel through the lymphatic system. Though it's not its primary function, they typically end up back into the bloodstream. Defending against infection, that is the main role. Number 39, which of the following plays a role in non-specific immunity? The answer is C. It is our natural killer cells. So our natural killer cells are part of the innate or non-specific immunity. They kill virus-infected cells. They kill cancerous cells without needing any natural killer cells. Again, naturally killing cells. They don't need a prior exposure. Again, T lymphocytes, their T cells are part of the adaptive, meaning they are specific. Antibodies are produced by B cells. They are a part of adaptive. Memory B cells provide the long-term immunity, which is specific. Number 40, the lymphatic system helps maintain fluid balance by, excuse me. Give you guys a moment to answer. And it's B, is returning leaked plasma proteins to the blood. So lymphatic system will collect leaked plasma proteins and interstitial fluid, return them back to the bloodstream. That's the main function. Secreting hormones, that is by the endocrine system. Again, sometimes hormones do enter, but it does get returned to the bloodstream. Producing red blood cells, that is in the bone marrow. Regulating body pH, that is done through the kidneys, lungs, and buffering, not the lymphatic system. 41, the primary function of the kidneys is to... What is the primary function of the kidneys? This is good notes, Sarah. I'll take a sip of my drink. My throat was getting a little dry. The answer is B. It is to regulate blood pressure and filter waste. My goodness. There we go. Third time's a charm. So the kidney is going to filter waste products from the blood, regulate electrolytes, maintain blood pressure by controlling the fluid balance and releasing like renin. 42. The structural and functional unit of the kidney is... The structural and functional unit of the kidney is... Thanks for the follow. I appreciate it. Thank you guys so much for following and liking the live. I appreciate it. The answer is C. It is a nephron. The glomerulus is part of a nephron, but it is not the whole entire functional unit. And some people get that kind of mixed up sometimes. Speaking of the glomerulus, number 43, what is the primary function of it? What is the primary function? Went to buy good notes, but Notabilian said it's pretty good. Yeah, I've tried both. I definitely preferred good notes. I kind of just worked a little easier, but I tried both, and I just went with good notes. They're definitely good. They're both good. There's no hate. It's kind of just a preference. All right, but the answer is filtration. The glomerulus filters blood, removes waste and excess substances. Basically, it retains our proteins and cells as well. Secretion is going to happen mainly in the tubules. Reabsorption is going to happen in the proximal tubule and the loop of Henle. And then excretion, that is going to be the final part, final removal of urine. So the glomerulus primarily filters. 44, the hormone that regulates sodium and water retention in the kidney is... Love Good Notes, use it for all my classes. Yeah, Good Notes is awesome. It's just very easy to use. I like, just simple. I know there's like a Good Notes 7 now, which I think is like... I don't know. You have to pay like monthly for that now, which I don't really, need it for that much more stuff. Like most stuff I just draw on my own or anything extra. Like I just need to write, move stuff around, put some pictures in. That's about it. The answer is B. The hormone that regulates sodium and water retention in the kidneys is aldosterone. So aldosterone is released by the adrenal glands. It increases sodium retention and potassium excretion. This is going to retain water and affect blood pressure. 45. Which part of the nephron is primarily responsible for reabsorption? And hello, everybody that just joined. Welcome. My name is Ollie. I have a master's degree in molecular medicine. I've been tutoring anatomy and physiology for 5 years, and I was a pharmacy tech for 4.5 years. And then I am working toward getting my PhD now. I do live streams essentially almost every single day. Starting May, so normally I go live every day, but I will start again May 26th going live every day, covering anatomy and physiology and other stuff that you guys request. For now, this week we were doing Monday and Tuesday. Next week we'll be live Monday and Tuesday. Monday will be A&P1, Tuesday A&P2, and then we will potentially go live some other days based upon request. Thanks for the follows, everybody. I really appreciate it. Welcome in if you're new here. Again, and then all these live streams are uploaded to YouTube. It's linked in my bio. My YouTube is my name. It's Ollie Herzig, again, or it's linked in my TikTok. And all of my study guides for anatomy and physiology and my notes, those are available, linked in my TikTok bio as well. But number 45, Which part of the nephron is primarily responsible for reabsorption? The answer is B. It is the proximal convoluted tubule. This is where most of the filtrate's water, electrolytes, and nutrients are reabsorbed. I'm going to move this down. But 46, antidiuretic hormone, or ADH, acts on which part of the nephron? Antidiuretic hormone acts on which part of the nephron? Yes, this is for anatomy and physiology too. Do I do microbiology? Yes, we do some microbiology sometimes. Definitely send me an email on any sort of microbiology topic requests of anything like that. Or send me a DM. We just covered our renal unit in med school. I love this. Awesome, fantastic. I'm glad this is helping. What is a good overall TEAS score, in my opinion? A good overall TEAS score is kind of what depends on what school you want to go to. The higher your score, the more competitive you're going to be at a better program. But above a 70, yeah, it's considered good. That's kind of the minimum cutoff. What time? It'll be 1 p.m. Eastern Standard Time. 1 p.m. Eastern Standard Time. Taking it in the summer. Awesome, yeah, we'll definitely do... what's my YouTube? It's my name here. This is my YouTube. It's linked in my TikTok bio. So I finished my anatomy final. I got a 93, and my final grade is a 101. Thanks so much for helping me. Awesome. Congratulations, Lily. Can we get a congratulations in the chat? Can I post my most recent video from live on TikTok to YouTube? Yes, so I do post them all to YouTube afterwards. The one from yesterday is uploading right now, and then this one will be uploaded later. This is Heat. I'm happy I followed you. Thanks, I'm happy you followed me as well. Do I do NCLEX review? I do some pharmacology NCLEX review. In terms of that, I'll be working on that soon, though, to do some more NCLEX review. But 46, antidiuretic hormone acts on which part of the nephron? The answer is C. It is the collecting duct. So ADH is going to increase water reabsorption in the collecting duct, reducing our urine output. And concentrating our urine. 47, what substance is not normally found in urine? And if it is, it's an indication of pathology. And what might that be? Neurosense review. Yes, we do as well. I will do pretty much anything that gets requested the most, yes. And I'll also make some videos and stuff. I've been trying to make more videos for YouTube as well. I've been wanting to do like kind of a lecture series for anatomy and physiology if people would be interested in that. Definitely for the summer. My goal is, I've been working on some of those videos now, but my goal would be to have those out, like kind of have all the lectures done by summer, so then for the fall, they're like kind of all done. That would be on YouTube, like full lecture style videos. And just study tips in general for each chapter. Thank you guys for all the follows and shares. Thank you. And all the likes on the live. You guys are awesome. Thanks for being here. I appreciate you guys. The answer is glucose. So it's going to be glyceria, which is an indication of diabetes. So urea is the waste product from protein metabolism. Creatine is a waste product from muscle metabolism, and sodium is excreted in the urine to help regulate electrolytes. 48, if a kidney's filtration rate decreases, what happens to our blood pressure? If I miss any questions, please feel free to put them back in. Sometimes I read on my screen and I miss a question or two. So definitely feel free to repeat your question. I promise I'm not ignoring you if I didn't answer your question. Thank you, Gans, for the finger hearts. You're awesome. Thank you so much. I appreciate you. Thank you for all the gifts. Fantastic. It would be A. It would be increases So a reduced filtration rate would lead to, this would be fluid retention, and this would cause increased blood pressure due to the activation of the renin, angiotensin, aldosterone system, the RAAS. 49, what structure carries urine from the kidneys to the bladder? So from the kidneys to the bladder. What would this be? Fantastic. It is the ureter. So the ureter goes from the kidneys to the bladder, and then the urethra is from the bladder to the external environment, which is hopefully the toilet. Or a nice bush if you're camping. Number 50, which condition is characterized by a sudden decrease in kidney function? Keyword sudden. Pay attention to the wording. Keyword sudden. Fantastic. Acute, sudden. Therefore, we have acute renal failure. B. So acute renal failure, you may have some sort of injury, infection, or an acute toxin exposure, which can lead to a decrease in kidney function. This is acute renal failure. Chronic is progressive, long-term. So if we were to change sudden to a long-term decrease in kidney function, that would be chronic, some sort of chronic. Kidney stones are mineral deposits that cause an obstruction. They don't necessarily directly cause sudden kidney failure, though. Then urinary tract infection. UTIs affect the bladder mainly in the urethra. They don't necessarily cause a sudden loss in kidney function. Moving on to reproductive system questions. Number 51. In males, sperm production occurs in the what? Sperm production occurs in the what? Yep, we can definitely, I love talking about some of the molecular details. Yeah, we can definitely, I can make some videos on that. All the study guides are on my website. It's linked in my bio on MedZeg. I have a link there as well. The answer is in male, sperm production occurs in the seminiferous tubules. So they are inside the testes, and they are the site of spermatogenesis. This is where sperm cells are produced. And I bumped my screen. Hopefully that's fine. Perfect. 52. What hormone triggers ovulation? What hormone triggers ovulation? And lectures free on YouTube. Yep, I will be. So right now I have, so all these TikTok live replays are on YouTube. My YouTube is my name, but it's also linked in my TikTok bio. I am currently working on putting out some anatomy and physiology lectures, but I do have other videos up there. So all the replays from TikTok are there of these practice tests. And then I do have some other videos on, like, I just posted a video recently on how I take the process of taking notes. I have some videos on YouTube about that, but I am working on a lecture series for anatomy and physiology. They're not posted yet, but they are currently being worked on. But 52, The answer is luteinizing hormone. It is referred to as the LH surge. This is what triggers ovulation. Ovulation is the release of the egg from the ovary. In terms of estrogen, estrogen helps regulate the menstrual cycle and promotes follicle growth. It does not directly cause ovulation. And then progesterone is going to maintain the uterine lining after ovulation, but it does not trigger it. And then follicle stimulating hormone, FSH, it is going to stimulate follicle development, but not trigger the ovulation. 53. What structure transports the fertilized egg to the uterus? For a 4-week accelerated course, how much study time is sustainable to get an A generally? So, a 4-week accelerated course, you're definitely going to have to be a lot more efficient. I always did like a 20 to 30 minute preview before class, and then I always did about like an hour or two after class, and on like Sundays, I would spend maybe like 3 to 4 hours studying. I think when it comes to an accelerated course, you just have to be consistent. It's like 4 weeks is going to suck, yeah, but if you stay consistent, you study what you learned in class that day for the week, and then at the end of the week, you go over it for a couple hours, you'll be fine. Just finished this class, 3rd try, finally with a B. Awesome, Kenzie, congratulations. Can we get a congratulations in the chat for Kenzie? But yeah. You have accelerated, stay consistent. That's the biggest thing, consistency. 53, it is the uterine or fallopian tubes. They transport the fertilized egg to the uterus. Fertilization typically occurs in the ampulla of the fallopian tube, and it'll get transported to the uterus. 54, the placenta serves all of the following functions except what? Placenta serves all the following functions except what? Perfect timing. Today's my final. Good luck on your final, Mel. My AP classes are fully online and on weekdays. Okay. Are they, if they're every day, I would do, whenever you have a lecture, spend an hour or two going over that lecture. Spend an hour after that reviewing what you just went over. On the weekend, try to do everything that you learned in that week. Practicing, Yes, this will be on YouTube later today if it'll upload in time. Or tomorrow. Kind of depends on the upload speed. 54, the answer is D. It is producing red blood cells for the fetus. So the placenta does not produce the red blood cells for the fetus. Instead, the fetal liver and bone marrow will produce them. Nutrient exchange, the placenta will exchange nutrients between the mother and the fetus. Gas exchange, the placenta does facilitate that oxygen to carbon dioxide exchange. And hormone production, the placenta produces hormones. Some of them are like HCG, estrogen, and progesterone. Basically, these are going to help maintain pregnancy. 55, in males, testosterone is produced by the... So testosterone is produced by Leydig cells in response to LH stimulation. So Leydig cells in the testes produce testosterone in response to LH stimulation. Answer choice A, the epididymis stores mature sperm. The seminiferous tubules produce sperm. The Sertoli cells within them support sperm development rather than producing testosterone. And the prostate gland is going to secrete fluid that is part of the semen, but it does not produce testosterone. Number 56, which gland is considered the master gland of the endocrine system? Yep, I do Zoom tutoring sessions. Definitely send me an email if you're interested. I also have everything listed on my website for that. So I wish I had pictures to show the functions better. So for whatever the reason, I agree with you. For whatever the reason, when I do pictures on a TikTok live stream, TikTok shuts it down. I have no idea why. Even if I draw them myself, it copyrights it, and it's like, it's my own drawing. I draw them. So I promise I tried that. I don't do biology. Yes, I do biology sometimes as well. Yes. So C, the answer is C, pituitary gland. The pituitary gland is our master gland, and the hypothalamus is our master regulator. But the pituitary gland will regulate many of the other endocrine glands through the hormones. 57, which hormone lowers blood glucose levels? How often do I do TEAS review? I do them at least twice a week. At least twice a week. Mostly on Mondays and Tuesdays. Pretty much every Monday and Tuesday is a HESI and TEAS review. Microbiology. Yep, we'll do microbiology. The answer is B, insulin. So insulin lowers blood glucose levels. Glucagon raises blood glucose levels. So insulin gets secreted by pancreas beta cells. And then specifically, insulin is going to allow cells to absorb glucose from the blood, lowering it. Glucagon is going to raise blood glucose by promoting glycogen breakdown in the liver, specifically. Cortisol will increase blood glucose by stimulating gluconeogenesis during periods of stress. Growth hormone is incorrect. It has a very mild glucose-raising effect. 58, the adrenal medulla produces. Thank you for the finger hearts. I appreciate you. Thank you so much. These questions are review for the TEAS. These questions are review for the TEAS. Can you give me advice? What advice are you looking for? Okay, perfect. I just worked and stumbled upon you. Fantastic. Thanks for stumbling up here. I appreciate you being here. The TEAS and HESI are different. Subscribe to your YouTube, Lifesaver. Awesome. Thank you so much, Carolina. Thank you so much. And MP1, where can I find the videos when I miss the live streams? On YouTube. It's my name, Ollie Hertzog. It's linked in my TikTok bio as well. This is my YouTube. And then my notes and study guides are also on my website. It's called Medzeg. Thank you guys for the gifts. Appreciate you guys. You guys are awesome. The adrenal medulla produces B's, epinephrine and norepinephrine. Cortisol gets produced by the adrenal cortex. So the adrenal medulla secretes epinephrine and norepinephrine in response to our fight or flight response. Cortisol is produced in the adrenal cortex, so core, cortisol, cortex, cortisol. Glucagon is secreted by the pancreas. Insulin is also produced by the pancreas. Yep, insulin for in. Yep, so that's an awesome way to remember it, yeah. 59. Which hormone regulates metabolism? Which hormone regulates metabolism? The TEAS stands for Test of Essential Academic Skills. So it's primarily for nursing and potentially some other like allied health program admissions. So it's like an admissions exam. The answer is thyroxine or T4. Remember, anything that has to do with the thyroid typically has to do with metabolism. So thyroxine, T4, and T3. Last question here, everybody. Number 60, parathyroid hormone primarily regulates the... These questions are review. T3 is also for regulating metabolism. It wasn't one of the answer choices. And the answer is calcium levels. So parathyroid hormone increases blood calcium levels by stimulating bone reabsorption, calcium reabsorption, vitamin D activation. If we remember osteoclasts, it increases the activity of osteoclasts, which break down bone. Calcitonin will do the opposite of parathyroid hormone. It's going to decrease blood calcium levels by doing the opposite, so it would increase osteoblast, decrease osteoclast. But that was all I had for today. Thank you, everybody, for joining. Again, my YouTube is up here. This is where the replay of the live stream will be. If you miss any or you join late or you can't finish for one, that's where it'll be. All my notes and study guides are on my website here, Medzeg. It's also linked in my TikTok bio. I'll be back again for sure next week, Monday and Tuesday at 1 p.m. Eastern Standard Time. Monday will be A&P 1, Tuesday A&P 2. We'll be going live every single day starting May 26th for the summer semester. I will go live probably again within the next 2 weeks before May 26th, outside of Monday and Tuesday upon request. Send me an email about that. But again, if you're new here, welcome. My name is Ollie. Thank you for being here. I just finished up my master's degree in molecular medicine, and I'm working on trying to get my PhD soon, so hopefully we can start that soon. Be happy to do that. I'll stick around here for just a couple minutes to answer some questions. If you have any before I go, just follow. Awesome, thank you. Congratulations, thank you. Thanks for going live. Do I have HESI question review on YouTube? Yes, I have a bunch of others on my website. Congrats on my master's. Thank you, thank you. I finished up in November. I finished in a year and 8 weeks. I did it a little faster. It was definitely rough, very busy. Looking forward to more lives. Thank you. But I'll stick around here for just a couple questions, just for a couple minutes, for like 4 or 5 minutes. Answer any quick questions. Again, those will be on YouTube afterwards as well. Any copies of these will be on my website. Finish in a year, so we're in this together. Awesome, good luck. I do cover medication quite. I do pharmacology as well. TEAS has a lot. It has like English on it, grammar, math, science in general, biology, chemistry, stuff like that. It does have anatomy and physiology on it as well. So finish. What are the topics for next week? So Monday, Tuesday will be A&P 1. Tuesday will be A and B2. Anything else is by request. Do I have any materials for NPD? Not currently, outside of anatomy and physiology. Any tips for studying and remembering? So the biggest thing when it comes to studying, I think is a lot of active, again, a lot of people say active recall. I think that you should, as you're going through material, you should be constantly questioning yourself. It's not that you have to answer questions like this, but in terms of when you're reading through, you'll be reading through your textbook, and it'll be, the topic might be lowering blood glucose. Okay, so then you read through it, and it's going to say it'll be like insulin. So insulin lowers blood glucose, and you want to look away, explain things out loud as you read it, ask questions, use lecture slide titles to make questions, and then go through and explain it out loud. Use your notes kind of as like a reference checklist when you make them. When you go through a textbook, use the section titles to make your questions as well. That's definitely the way to Professor Goodnuts. Thank you. Yeah, thanks for being here. Appreciate it. Do I have material on only physiology? Nope, I do have anatomy material as well. Do you want on the eye and octave nerve at some point in the future? Yes, absolutely. Send me like a DM or leave a comment or send me an email on exactly what you want to see on the eye and optic nerve. Access to the questions will be on my website. Can you cover eye, ear, and also the digestive system? Yep, absolutely. Yeah, we can do more in-depth questions. I'll probably put those on my website soon enough. I'm from Afghanistan. I want to start sonography. Where to start? So I'm not exactly sure about Afghanistan. I'm pretty aware of what goes on with sonography in the U.S. But you probably have to you probably have to have your good grades in like biology, some physics, math. Check on look up programs in your country and see what their requirements are, and follow from there. But that's how you want to get started. Start by contacting the school that you're interested in, looking at what their requirements are, and whatnot. Is nursing anatomy and physiology hard as medical school anatomy and physiology? So what I've noticed from nursing, I've tutored both med and nursing students. Medical school is a lot more in-depth in terms of more of the why. So my website is medzig right here. It's also linked in my bio. But nursing anatomy is more surface level. It's still difficult, don't get me wrong. Medical school anatomy is definitely a lot harder, though. So nursing A&P is a little more broader. Medical school anatomy is very deep and detailed. Nursing application in terms of anatomy and physiology might be on vital signs, some common diseases. Med school A&P, detailed structures, functions, pathologies, histology, and definitely a lot more fast-paced. Med school is significantly harder, for sure, in terms of the volume and speed and the integration with clinical cases, pathology. Definitely, yes, I've tutored both. My graduate school anatomy was so much harder than my undergraduate anatomy. A lot faster paced, a lot harder questions. Thank you. I'll see you next week. In the USA. Yep, definitely contact programs and see their prereqs. You might have to... You're in the USA now. Perfect. Yep, definitely whatever school you want to go to, how I recommend starting, looking at the school, looking at what they require, going and getting those prereqs, That's what that's mainly focused on. Do I think it's possible to get A's in college with zero background in science? Yeah, it's definitely possible. You definitely probably have to put in a little more work. Probably in the beginning, you might have a harder time getting started with in terms of medical term. Like, to start in anatomy, you definitely want to have a good foundation in medical terminology, some good cell bio, in terms of like the foundation, like what's a nucleus, what does it do, the cell, kind of like cell structure, a little bit of a chemistry overview as well. It may take you a little bit of time to grasp it, but if once you get those down, it makes other things a little easier to understand. But they definitely have a little bit of science review in the beginning to make sure that you're good, for the most part. Taking the TEAS tomorrow, I'm so nervous. It's a retake, so I'm a little extra nervy. Don't be nervous, you got this. Just make sure. And on my website again, it's Medzeg, it's right here. It's also linked in my bio. What's a question that you'd see in a medical school anatomy course? So, for an example, you would be given an exam like a something-year-old person comes in with a fracture to, let's just say like the humerus, kind of near the mid-shaft after a motorcycle incident. There's going to be some exam and symptom questions like he can extend his wrist and fingers. His hand may be limp. In terms of this, like what nerve is most likely injured, or what muscle what muscle may be damaged, in terms of being the reason why he can't extend his wrist or his fingers. So it's going to be a lot more it's more case based instead of straightforward. So a question might, instead of just having like which hormone lowers blood glucose levels, you're going to get tested on anatomical location, function, clinical presentation, gross anatomy, potential a little bit of neuroanatomy, symptoms, medication potentially. But yeah, so it kind of encompasses, so it's more so information from different parts into like one kind of thing. That's probably the best way to explain it. Some sonography programs are 2 years, some are 4. Like I said, definitely look up the programs near you. They're going to tell you a lot more than I would be able to do. I never took A&P in high school. In your experience, nursing professor through high school? No. So there's review on like some medical terminology, some cell bio, and chemistry, but they're going to move pretty fast. They're going to expect that to be a review for you, so that's going to move pretty quickly. Any other quick questions before I get going here, guys? Thanks for watching, everybody. Thanks for following. Thanks for being here. I appreciate you guys joining. I love doing this. Again, I'll be live again tomorrow, or next week on Monday and Tuesday. Potentially this week again. Kind of depends on requests. Trying to get better with electrolytes, hypo symptoms. I just focus on the major ones. Yep, definitely on the major ones, and then kind of use those to kind of guide your learning on other ones. Wanted to step in and say I passed the TEAS exam a couple weeks ago. You were a huge help. Thank you so much, Meg. Congratulations. That's awesome. Thanks for letting me know that you passed. I'm definitely proud of you. I hope you're proud of yourself too, Meg. Tomorrow 1. If I do go live, it'll be at 1 p.m. I'm not sure yet, though. But if I do go live, it will be at 1 p.m. thank you guys so much for being here. Again, we'll be back again next week. May 26th, we'll be back every single day for sure. Again, this will be on YouTube afterwards as well. I will download it as soon. I think the one from yesterday should be up relatively soon. But thank you all. Have a great rest of your day. Hopefully we'll see you all next week or in future live streams. Thank you guys so much for joining. This live stream was so much fun to do. Thank you guys so much. Have a great rest of your day.